So before I start, I know I look kind of bigger. It's because I'm on prednisone right now, really heavy, trying to still maintain my weight. But I'll talk about it in another post. But I have to take prednisone for an issue that's going on with my kidney. So they put me on a large dose. So that's why my face is looking a little. But yeah, nevertheless. I want to talk to you guys today about something that's not really related to lupus, but lupus patients know. And if you're a new lupus patient, you will know that when you have lupus, anything else that you go through is 10 times worse, or feels 10 times worse. So today I'm going to talk about fibroids. So it was another thing that I dealt with in all my years of going through things. But a lot of women deal with fibroids. They go through them. Some have really small ones, some have really big ones. Some don't bother them as much and they don't have to do anything to them. Some have really bad ones and have to get them removed. So my fibroid journey. So it started in like 2013-ish. I was getting really, really big, and this was way well after college. So I, dealt with my lupus stuff. Always with lupus, you have remission where you're good, and then you have times where it's really bad, and it varies from day to day. So I was graduated from college in 2009. Whoop whoop, VCU, always a ram. But then I was good. I was working, got a job at Fort Belvoir Military Hospital. I was working, doing good. And then around 2013, I started to really blow up with my weight. I got accused of being pregnant on multiple occasions, and it was really just in my abdomen. Like, my periods had always been pretty heavy and pretty bad. I'd get really bad cramping where I'd have to like stay home from school. My cycles were just bad. I know some of you guys can relate. My cycles were just bad. I got my cycle really early, around age 8. So it was just something that I learned to deal with. I knew once a month I would have pain, and I would have to take Motrin or whatever to ease the pain, and it was going to be really bad. But around 2013, they started to get progressively worse, which I didn't even think was possible because they were so bad. But they were really, really bad. I mean, I would stay home from work. I couldn't move. I'd have to go to the hospital sometimes to get stronger pain meds because it was so bad. And then I was losing large amounts of blood. So in addition to gaining all this extra weight in my tummy, I was just losing large amounts of blood. So went to my OB, and she's like, yeah, you have fibroids. They looked around. They were like, yeah, you have fibroids pretty bad. They're the size of grapefruits. I don't think they knew how many, but they saw a lot. So they were like, well, we need to remove these fibroids. And of course, at this point, there was like laparoscopic surgeries and all this new technology. And they were like, well, we could do it minimally invasive so that you don't have a lot of scarring and stuff. We know you have the lupus going on and you've had biopsies on your kidney and some other stuff. But we can do it minimally invasive. So I was like, all right, well, let's look into that, see what we can do. And I ended up going to a pretty well-renowned surgeon, and he took a look, did my scan, and they found 15 fibroids. And 90% of those were the size of grapefruits. So that is why my stomach was so big. I could also tell, like, bloating my face and stuff. And as I said, I was being accused of being pregnant all the time. So nevertheless, he agreed to do my surgery. And he said, the scope of the surgery is these are too big and you have too much going on there that I cannot do it laparoscopically, but I will make it minimal scarring as possible. So they went in and did a myomectomy and cut me with at my lower abdomen, so it made like a C-section scar. He was able to remove all 15, but so the surgery took so long and it was so delicate, there was a lot of scarring in my abdomen. So it took me a really long time to heal from that internally. Outside, the healing was quick, but it took me a while to heal internally. And I went back for my checkup to make sure I was healing well, but I was not. I was having really bad pain still. And this was 2 weeks after, having really bad pain, having abnormal discharge, and like oozing from the site. I didn't feel good. So I went back, talked to him. He examined me and he's like, you know, these are normal symptoms. You went through a really big surgery. You'll be okay. You know, come back and check in with me in another 2 weeks. As I did, and I monitored myself. So I monitored the discharge, color, smell, everything. I monitored like how I was feeling, everything. Went back. He's like, all right, well, if it's not fixed, let's try to put a balloon up there. He said the balloon would open up like the walls of my uterus and hopefully help this scar tissue. So I said, okay. And he said, and then I would be in less pain. So I said, okay. The pain was majority when I urinated. It was like a UTI on steroids. It was really bad. So they put the balloon up there. Helped a little, but not really. Still was having discharge, still was having everything. So went back in again in another 2 weeks, and he's like, well, it looks like there might be some more fibroids in there. We might have to go back and do another surgery. So my first fibroid surgery was September 3rd, 2013. And then the second one that he was planning to do was he planned for January 10th, 2014. So I went back in 2014, January, and was unable to even do anything. The scar tissue was so much. There was so much scarring in there. Like when they went back in, they opened me back up. He couldn't get in to see what he needed to see, like where the discharge was coming from, if there was any fibroids left. So they sewed me back up and talked to me again and said, you know what, let's let it heal a little bit. And you come back in a couple months. We'll do it again. So I said, okay. They put me on pain medicine and told me to wait. So they did another surgery April 4th, 2014 to see what was going on. The discharge was still going on. The pain was still going on. UTI and steroids, really bad. So they went in April 4th and same thing. Too much scarring. They couldn't see what they were looking for. Sewed me back up. Told me I have to wait again. I was over it. I was like, you guys cut on me 3 times now and not been able to tell me anything. I'm in massive amounts of pain, even though you have me on pain medicine. And they had me on Dilaudid. So even with the Dilaudid, I was still in pain. I mean, I could not use the bathroom without being in pain. And I mean, when I say pain, I was screaming, like bloody murder screaming, rocking on the bathroom, back and forth on the toilet, screaming, holding myself because I knew that I had to pee. I didn't want to because it was hurting so much. Like, worst thing ever.
Jesus, please, Father God, please, Father God. Oh dear Jesus, 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 oh dear Jesus. Father God, we pray, come. Jesus, we pray, Jesus, oh God. Yes, oh God, Jesus, thank you, Father, thank you, God. Thank you, Jesus, thank you, God. Thank you, Father God. Thank you, Jesus, thank you, God. Thank you, by your stripes she's healed, by your stripes she's healed, by your stripes she's healed. By your stripes she's healed, by your stripes she's healed, by your stripes she's healed. Thank you, Jesus, thank you, Jesus.
I took a painkiller about an hour ago, so I can't take another one. Oh my God, please. Please, Jesus. Please, Jesus. Please, please. Oh. 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 So I seeked a second opinion. So I went to another urogynecologist, and she said, you know what? I can handle this. There's probably more fibroids in there. Let's do a consult and see what we can do. So while I'm doing consults and stuff, of course, I still have lupus. So they did do a kidney biopsy July 18th, 2014, because I was still dealing with that. That doesn't just stop. Just because you're dealing with something else, your lupus doesn't just stop. Like I said, in a lupus patient, whatever you're dealing with seems 10 times worse because you're still dealing with lupus. You're still having joint pain. You're still having all that. And at that point, my kidneys had been through it. So they did the kidney biopsy and they said, you know, my percentage of kidney usage is really low. So they told me to kind of start planning, looking to the future, which would be dialysis for me. It's not the best conversation, but I thought about it, but it wasn't in the forefront of my mind because the forefront of my mind was these fibroids. I was in pain, and that's all I could think about. Before my new surgeon did the surgery, she wanted to rule out a couple things. So she did do, on October 5th, 2014, she did a cystoscopy bladder biopsy. Because she said, well, maybe it's not, you know, your uterus, maybe it's in your bladder because it's when you're peeing. So they did a bladder biopsy and found nothing. So she said, okay, it's not your bladder. Let's go in laparoscopically this time and do another myomectomy. So when they do it laparoscopically, not like the first time, they use a robot, and the robot cuts tiny slits in your stomach and is able to remove the fibroids from that way. But when she went in, that was September 17th, 2014. She went in and I had a cyst on my right ovary that she had to remove. My fallopian tubes were shot. Well, one side of my fallopian tubes was shot, so she removed my fallopian tubes on the right side. And she saw that my colon and uterus had fused together. She didn't really mention too much about it, but she said something to my uncle who was in the hospital with me at the time and said, I think there's some organs that are fused together in there. And she said the uterus and the colon, but she didn't really get as much of a good look as she wanted to look. But she wasn't able to really remove any of the fibroids, although she did remove the cyst from my ovary and the fallopian tube. On top of it, because I had been given so many antibiotics to treat what they thought was a UTI, possible UTI infection, because I was burning while I was peeing, I contracted a infection called C. diff. And if you've ever heard of C. diff or dealt with C. diff, it is the worst. It is a stool disease. It's an infection in your stool. It's contracted by stool. Like if someone were to touch your stool or anything like that, that is how they get in contact with it. But you don't have to get it from touching someone's stool. It could be from too many antibiotics in your system or anything. I have the C. diff. When you have C. diff, you're on isolation. So that means when you're in a room in the hospital, they treat you like a leper. Everyone has to wear gloves, a mask, and gowns to come in, whether they're a visitor, a doctor, a nurse, anything. Even the cleaning crew has to wear that. Like, they don't want to be contaminated, so they can't breathe the air in there. They can't touch anything that you've touched. It's a bad feeling. But once you have it once and they mark your chart, you're kind of like marked forever. So anytime I go in the hospital now, they have me in isolation, which really sucks. But so they treated me for C. diff right after they finished that surgery. And we waited and thought everything was good, but it wasn't. 2 weeks later, still having discharge, still having massive amounts of pain when I pee. I was over it. So went back to the doctor, told her I'm still having this pain. I don't know what to do. All the meanwhile, I'm still on pain medicine. It's continuing. I've been on pain meds for about over 6 months now. And Dilaudid is a strong drug. I had a pain management specialist who told me verbatim what happens to my patients who are on long-term pain meds. Their body gets used to it. They have to go up on the drugs, and some of them have passed because they need such high dosages of the drugs that their body can no longer handle it and they can't live. So that was scary. So I remained on a dosage of 4 milligrams. I refused to go higher even if the pain was worse. After what she told me, I was like, no. So I stayed on 4 milligrams, and anytime the pain didn't come down with the 4 milligrams, I was in the hospital. And I was in the hospital at least once a week. It was tough. But consulted with my doctor again, and we decided to do one more surgery in December. So in December, they did another myomectomy. It was not laparoscopic. She found a fibroid that was infected. And so she went in to remove it and was only able to remove 75%. The other 25% was attached to my uterus, and so they couldn't take it out. She said when she cut it, it was oozing, and so they had to try to contain that so it didn't get into other parts of my body. They ended up cutting me from my belly button down, which was really painful. They didn't stitch it up completely. They stitched it a little bit, but stapled it. And then I contracted C. diff again and had to be treated for that. So even after discharge, I was sent home with a PICC line and treated for 3 weeks on more antibiotics. So it was just not the best time. I thought to myself, okay, at least we did this and the pain is gone. But right after that, the fibroids were gone, but the pain was still there. It still hurt when I peed. I mean, even trying to go to work, I was in the bathroom at work, like, it was horrible. But I mean, lupus made me strong for this, because I knew I had been through worse things, and I knew, like, I still gotta work, I still gotta do stuff. I'm an adult. So rather than, if I took off all the times that I was in pain, I would be on disability, because I couldn't work. I mean, literally every time I went to the bathroom, it was bad. I toughed it out. I was at work, didn't let nobody see me sweat. Nobody knew what I was going through, and I just did what I had to do. But it was rough. Like, females, if you've ever experienced a UTI, woo! And on top of it, every time I was in the hospital, they put a catheter in me. Catheters are the worst thing. I don't know how men do it. It's bad for females, so I can only imagine how males do it. But catheters are the worst thing. But because of the infection and because of the pain during urination, anytime I went in, I was put on a catheter. Mind you, I told you I went at least once a week for the pain. So just imagine, just the worst. It was just the worst. I know I'm saying worst a lot, but worst is the only way I can describe it, because it was the worst. Total of 5 fibroid surgery, and all of them were removed except for the last 25% that is still attached to my uterus. Although I had that all done and over with by 2015, even now when I get my cycles, they're pretty bad as far as pain, and I still lose a whole lot of blood. Following up with my OB now, she said, you know, since it runs in the family and it could come back, who knows? They asked me several times, do I want to remove my uterus? But I'm 32 and I still have hopes to have kids. I know I've been told, and that's another thing I'll talk about another day, I've been told that it will be truly hard or it's impossible for me. But nothing is impossible with God. So that's another topic I'm going to talk about. But yeah, they tried to take my uterus several times and I was like, no. So I still have it. And they said there is a possibility of more fibroids. But I rebuke that in Jesus' name. So right now, at least, the pain did continue. The pain continued for 2.5 years. The pain actually didn't go away until my kidney transplant surgery. That's when they found what it was and could stop it. And I had kidney transplant surgery December 2016. So, so yeah, just about 2 years of full-on pain. But at least the fibroids themselves were gone. My weight was back to normal and I wasn't looking pregnant anymore, but I was still having that pain and they couldn't figure out what it was. And at that point they said, well, maybe it doesn't have anything to do with your fibroids, maybe it's something else. So they just kept thinking maybe it was my bladder and maybe I needed bladder distension and all kinds of things that they were trying, but nothing was working. And it's not until 2 years later that they actually found out and was able to fix it. So I'll tell you more about how they fixed it later, but my stint with fibroids was a long one, and a very unpleasant one. I'm glad they're gone now, and I will follow up with you guys when it's time for me to get pregnant. Not anytime soon, but just when it is. But yeah, so fibroids are no fun. Women go through them all the time, but just make sure you have a bomb surgeon who listens to you, talks you through things, tells you everything, and is concerned. Watch yourself on pain meds. I didn't get addicted. My body did not crave them. I did not even like to be on them, but I was on them for a very long time. 2 years to be exact. Not on them now. Didn't have a problem getting off of them. I could stop them at any time, but it's not that easy for some people. So definitely watch that. And ladies, just listen to your bodies. Know your bodies. I know everybody's situation is different. Some people have, like I said, small fibroids. They don't have to do anything about them. But consult your OBGYN and really look into it. And those of you who have lupus and are dealing with something like fibroids, it's tough. It's tough because you have to balance your lupus with your other stuff. But we're fighters and we're strong. Go Lupus. So don't stress it. Just get in support groups and talk to people. I have and had a really strong support system back then, and do now. And I always talk to people in my circles and make sure that I feel supported. And if I have questions or if I feel down, that's the best way to get through things like that. And just know that you're awesome. If you tell yourself you're awesome, then you are awesome, and you just don't feel as bad about your situation, or at least I didn't. I told myself I was awesome every single day, because I am awesome every single day. But yeah, so stay tuned for my next video. Subscribe. In the next video, before I get into dialysis, kidney stuff, is about dating with lupus. It's gonna be interesting. But yeah, stay tuned and subscribe. Tell people. Follow me. All right. Thanks, guys.